I appeal Ipshita to start the session. Please, Ipshita.
Sure. Good evening, everyone. I am Ipsita Naik. I welcome all the joiners, dignitaries, and active learners. To this session under SOCH, that stands for Socio-Economic, Organizational, Cultural Harmony among G20 nations. About G20, India is one of the oldest civilizations with one of the youngest population under and perhaps the most diverse and vibrant democracy. More than 50% of India's current population is below the age of 25 years and over 65% is below the age of 35. Even as global population continue to age, our younger demographic profile can be an asset not just domestically, but in the larger global context as India's G20 presidents offer India's youth the coveted opportunity to become ambassador of global causes. Today we have Dr. Mandakini Shukla ma'am, a dental surgeon practicing in Delhi NCR, holds a bachelor's degree in dental sciences from Suvarti Dental College, Meerut. Post her education, she joined Sudha Rastogi College of Dental Sciences, Faridabad, where she practiced as well as taught aspiring dentist as a lecturer for over 4 years. She moved on to set up her own private practice, the Expert Dental for Better Dentists in Faridabad, Haryana, where she particularly engages in pediatric dentists as someone who has always been passionate about giving back to the society. She started getting involved in philanthropic activities, first locally and then formally with Hasna Foundation. Hasna Healthy Affordable Solution nationally for Aam Aadmi Foundation. Her passion has led her to be engaged deeply on this front. Starting with the remote rural areas of Haryana, she moved on to conduct several oral hygiene awareness campus across Delhi NCR and has been continuously working at the grassroots level with thousands of villagers. Over the last 5 years, she furthered the cause to the remote rural areas of Prayagraj as well. In her capacity as the Haryana state in charge for Hasna Foundation, she has been working even the corona time by conducting online dental hygiene sessions throughout Delhi NCR. And today she is joining us to convey talk on comparative health or hygiene status among G20 nations. Thank you, ma'am, for showing your presence. Please enlighten us with your words. Thank you.
Good evening, everyone, and thank you so much for the introduction. Atmanirbhar Bharat learning platform is not new for me. I have always been a part of this organization, and many thanks to Pradeep sir for giving me this opportunity to always interact with everyone here. I mean, I think we all are so blessed to have sir as our mentor, because without him, we just could not be anywhere. So I hope I am audible to you all. Maybe
Yes, ma'am, you are audible.
Okay.
Yeah.
Okay. So once again, thanking Pradeep sir, and now so good to see you all here on this platform. And it's the first time that I'm interacting with you all. Very nice to see Malti all smiling, and Ipsita also. And other videos are off, so I'm not being able to see others. But being a dentist, I always see other people's smiles, and I'm always happy to see everybody smile. As a dentist, it matters a lot to me to see everybody smiling with good, happy, healthy teeth. Right. So in my capacity as a dentist, I can see more videos now on. That's good. So in my capacity as a dentist, I would like to talk about health today. Right. So regarding this topic, it's a very sensitive issue. If I talk about health, it is a very sensitive issue, and health is one parameter which is important to everybody, be it any country, be it any nation, any region, any local community, or anything at all. It is always very important that the healthcare of a place is always maintained. So, as we all know, the theme for this year, the G20 presidency that India has got, India has chosen a very beautiful theme for this year, which is Vasudev Kutumbakam. That means one family, one world, one family. And along with this, I would like to add another word to it, which is one health. When we are one world, when we are one family, then obviously we are one health also. Our health is connected too. So health is a very, very important parameter. No nation can grow without good health of its citizens and residents. Right. So taking this thing, health parameter forward, there have been lots of meetings, congregations regarding health, how to take healthcare forward. And now that we are living in a post-COVID era, we know that how important health is to all of us, how unpredictable life is when it comes to health and life, and how we all have to, improve our health, improve the health of our family members, friends, and the community at large to achieve better goals. Health nahi hai to kuch bhi nahi hai. We are nothing. If our bodies are not there, not functioning properly, nothing. So first of all, let us understand here that what kind of health are we talking about, right? We usually say, oh, I'm not feeling well today. I'm having a headache, maybe fever, cough, cold, body ache, or maybe some other disease, that we relate with health. But according to the World Health Organization, and you also will understand this thing, that health is not only the absence of disease or illness. Health is much more than that. Health is being in the right spirit, in the right mind, in the right emotions. If I'm talking to you, I'm smiling and all, but deep within my heart, I'm not feeling well, I'm feeling sad about something, I'm anxious, I'm not feeling good about anything. So automatically it will start reflecting on my face also. Okay. In the way I'm talking, in the way I'm conversing, I will not feel happy about it. Somewhere I will feel that nahi, acha nahi lag raha hai. So that also is a part of health, which is called mental health or mental awareness, right? So in the post-COVID era, we now know that mental health is also very important. In COVID times, we were sitting in our homes, we were, talking about health, COVID and everything. Maybe we were safe in our homes, but actually we were at all that times, we were anxious also. We were disturbed also. We were having, this anxiety, continuous anxiety in our minds that kya hoga, kya hoga, kya hoga. So in our anxiety, in our mental state, we were not good actually. So that also is counting as a very important health parameter now, which is good mental health. So what is health? Health is being fit in the body, physically, mentally, emotionally. All these things count under health. Now, in a world, where we have billions and billions of people staying today, and the world population is increasing at an unprecedented rate even today, we need to think about so many other things regarding health. So, taking this forward, I would like to tell you a basic about what all has been discussed till now, what all things have been taken into consideration. So India is doing the presidency for G20 for 2023. Last year, in 2022, the G20 presidency was held in Indonesia. And in Indonesia, the health minister of Indonesia last year His name was Mr. Budi Gunadi. So Mr. Budi Gunadi, he spoke about health, and he said that, we need to achieve one health to achieve health security, which will later on take us to good economic stability also. Good health of citizens means good economic stability also. So this was proposed in 2020 by the government of Indonesia, right? So then over the last few years, this topic or this discussion has been going on that we need to, have one health parameter which applies to all the countries, be it the developing countries or the low middle income countries, or whichever countries, even the developed nations also. We need to have one health parameter which can encompass all the things, which can have all the countries together, so that we can jointly come up and fight these health problems. For example, COVID. We have to come together and jointly we have to fight this problem, right? So these countries, the G20 presidency came up with a plan which was called the One Health Joint Plan, that all the countries will come together, all the organizations will come together, and everybody will work together for the betterment of health for everyone. So for achieving this one joint health program, 4 organizations came together. These 4 organizations are called the quadripartite organizations. Quadripartite means, quad means 4. So quadripartite organizations means 4 organizations coming together, right? So which are these 4 organizations? It is the Food and Agricultural Organization, the United Nations Environment Program, the World Organization for Annual Health, and the World Health Organization. So all these organizations have collaborated together to bring up one joint health action program, right? And these programs excuse me, these organizations are working together to bring health on a more global stage and do better. So there has to be an integrated approach, right? So that we can all work together. As they say, there is no health without one health. Excuse me. So what happened was that in 2022, these quadripartite organizations, that means these 4 organizations, which I told you right now, they all got in together and they worked with the government of Indonesia, right? And they got one policy. That policy was named the Lombok G20 Health Policy. The Lombok G20 Health Policy, which was brought in together by the government of Indonesia and these quadripartite organizations. And they brought about one joint health program, right? One policy they brought out, and now they are working on that policy to achieve better goals. What does that policy say? That policy says that we have to raise awareness first. Why is awareness important? For prevention. See, if we can prevent a disease, there is nothing like it, right? So prevention is better than cure. Prevention is better than cure, right? So first point was to raise awareness and advocacy for the One Health priorities. Next was identifying gaps in the healthcare, deliveries. How is the healthcare being delivered? So there are gaps. We have to identify those gaps. We have to find out those opportunities, and we have to make use of those opportunities to provide better healthcare systems. For example, in India, the rural communities are still struggling a lot, right? In rural villages, in remote areas, there are still no good healthcare facilities available, right? If there is a primary health center, the doctor is not there. If the doctor is there, the nurse is not there. 24/7 availability is not there. Ambulances are not there, right? Connectivity to the nearest district hospital or the good hospitals, that is not there. So, these are the gaps. And the opportunity is there. India is a huge country and there are lots of good educated people in the healthcare sector. So we can give them these opportunities, we can work around them so that these people can have these opportunities, and we can fill up these gaps so that the whole community takes advantage of this. The healthcare improves for everybody, right? And when we are able to cure those villagers, or in time action can be taken towards health, then the situation does not turn into an emergency, or it does not go out of hand, right? If we can treat those villagers, or we can give them timely treatment or prevention, like there are so many diseases like waterborne diseases. People in villages, they don't wash their hands, so now lots of diseases come through that only. Malaria, there in villages, malaria, dengue, chikungunya, they spread like fire. So we can raise awareness about all these things, and simple things have to be done. पानी ना इकट्ठा होने दे, सफाई रखें, तो कूलर में पानी जो भर रहे हैं उसको बदलते रहें. All these things, we have to make people aware. These are simple things, but they can bring about a huge change, right? So these are the policies. Then we can improve the governance. Governance, what does governance means? काम हो कैसे रहा है? How are we doing all this work, right? Whether it is being implemented at the ground or the grassroots level or not. So even that is very important, right? And next one thing, funding. अब हमने ये सब बातें तो कर ली हैं, but from where will the funds come? We have to bring a joint program so that we can have all this funding together. We can, come together and raise funds to implement these actions all over the world. See, India is there. Apart from India, there are so many other countries, that have with middle or low income groups. So they also have to be supported. African nations are there, right? Other Asian countries are also there, which might not be part of the G20 program, but still they need support, right? So if I talk about all these diseases that come together, like say, for example, these diseases, like I was talking about right now, malaria, typhoid, dengue, chikungunya. These, as you all know, these diseases have been divided into two parts. One are the communicable diseases and one are the non-communicable diseases. So communicable diseases like HIV, AIDS, tuberculosis. Tuberculosis, my dear students, is a very, very big problem in India. Why is it a very big problem? First of all, the disease itself. Secondly, tuberculosis is not a 1 day or 2 day treatment. कि भाई आप 2 दिन दवा खा लो आप ठीक हो जाओगे. For tuberculosis, you need to take medicines for months, 3 months, 6 months, 1 year, and people don't do it. They will take the medicine for some time, and then when they start feeling better, they will stop taking the medicine. In those cases, what happens? The disease aggravates. वो disease और बढ़ जाती है. So all the people, they have to be taught कि नहीं, एक बार दवाई लेनी है. अगर डॉक्टर ने आपको बताया है कि आपको 3 महीने तक दवा लेनी है, means you have to take medicine for 3 months. They will take it for 3 weeks and then they will stop it. So what happens? The TB complicates and there is a lung collapse and the patient dies. So even simple diseases like TB, diarrhea, right? Viral infections like zukam, khasi, bukhar. Do you know, even today, millions of people across the globe die because of common cold. Not COVID, common cold. Sardi, zukam, khasi se log mar jate hain. Why? Because they don't take medicine on time. They don't follow the doctor's instructions. The situation complicates. Lungs mein pani bhar jata hai. And then it becomes, a grave situation and the patient dies. Why? Because of common cold. Why? Because the people are not aware. People are not taking medicine. They're not going to the hospital on time. And this happens a lot in India. They will go for all kinds of herbal treatments, Ayurvedic treatments, everything. And when the situation goes totally out of control, then they rush to the doctor, and then the doctor is not able to do anything. So when to go to the doctor, how to raise this awareness, this is something that people have to be made aware about, and we need to identify and allocate healthcare professionals to help people come out of this awareness problem, right? Another, yeah.
Sorry to interrupt you, but wanted to take you back to the initial part of the discussion. What you said, we want the audience would be love to know that how to if you see the healthcare system in a global perspective, how you can tell it in a individual's way and a healthcare provider's way, how you see the global healthcare system as a system.
Yes. If I see the global healthcare system, right, these diseases like hypertension, diabetes, these are major goals that we have to achieve. Now, how do we achieve this? Even in countries like the developed nations, if I talk about the developed nations, I'm coming to non-communicable diseases. If you look at these developed nations, for example, US, UK, right, all these countries, they have a lot of lifestyle diseases because their diet is such. They face a lot of problems like these. For example, ischemic heart disease, diabetes. India is the diabetes capital of the world, right? Cancers. We don't have it here, but if you see in the Western countries, they have a lot of skin cancer patients. Lots of skin cancer spreads there. So we don't have very good systems in place so that all patients can benefit. That's the top class benefits. But in US also, in Australia also, in UK also, all these G20 countries, we have patients who cannot afford treatment. That high medical treatment of the US and all. That is why they sometimes come to India for treatment, which is called medical tourism. They come to India for treatment because they cannot afford treatment. So here is where we can all come in together and raise awareness as a one health. This is a global thing, right? Because now in today's era, when we are connecting virtually and everything in every way possible, we cannot call ourselves only as Indian citizens. We all have become global citizens.
Yes.
So maybe there is a patient sitting in the US and he is connecting with me over Zoom and discussing about his dental problem, right? And it happens so many times. So we are all global citizens. Now, how do we get integrated into all this, and how do we raise awareness across the globe? That is one thing. So that is why these quadripartite organizations, they have come together to make one agenda, which is called the One Health Agenda, right? And towards this, they are working towards bringing more integrated healthcare, more awareness, right? So we have to make healthcare professionals available so that they can connect with a person sitting from the US can connect with somebody who's sitting here in India, right? So for example, there is a patient of mine who lives in Australia. So how do I connect to that person? Right. But that is possible in today's world. That is possible in today's world. Even those who are sitting in remote rural areas of India or maybe some other country, like the other, for example, say Pakistan, Afghanistan, and all these countries, low middle income countries, we can connect to these people also. So this is something that we have to do at an international level. This is what we can do at an international level, where the governments can come together and create a scenario in which we can connect to these patients and provide them medical treatment like that. So this is what these simple diseases, what I was talking about, these simple diseases can be, cured through these types of interactions. Like, for example, I would say in Africa, there is a lot of scarcity of water. We have been talking about pandemics, right? We have been talking about wash your hands with soap and water, wash your hands with soap and water. But where is the water? Where is the soap? Where is the good food? Ask those African nations who are facing, famine. There is no rainfall. There is no water. There is no money to buy soap. So how do we address that? How can we, sitting here in India, can we address that do happening there in Africa? Okay, we can maybe guide them, but how do we make those materials available to them, right? How can India help another developing nation or some nation in Africa where people don't have soaps, they don't have sanitizers? How can we help? Like, for example, India did help. India sent over uh, vaccines when India was one of the countries which developed vaccines in the first place for the COVID vaccine. I'm saying the COVID vaccine, India was one of the first countries to come up with the COVID vaccines, right? And uh, India was one of the countries who exported these vaccines to the other countries as well, especially the needy countries. But
Hmm.
still, there are so many countries who got the COVID vaccine after several months. And what was the result? Several people lost their lives. Several people lost their lives. So here I would say, I would discuss later also. I would say, like, if we are discussing epidemics and pandemics, if you all know what are epidemics and pandemics, I will just tell you in a small brief. Epidemic is something, which happens in a small area. Like these days, if I talk in India, in the India right now, we are all having cold, cough, flu. So it is an epidemic. In India, it is happening. It is not happening in America or UK right now, right? So maybe there is some other problem that is happening there, right? So it's an epidemic. And what is a pandemic? Which affects the entire globe at one go. For example, as of now, we are facing COVID. इससे पहले भी there have been so many, there was the bubonic plague which happened 100 years back. That was a pandemic which affects the globe. And when it affects the globe, it not only affects the health, it affects the economy also, finances, and so many other things that are, business and everything. Everything goes haywire. Everything goes haywire. So epidemics and pandemics, they keep coming and they will keep coming. In the next 10 years, they are expecting another pandemic. Now, we don't know what is the nature of the pandemic. We don't know, but yes, it has been predicted. And pandemics have been coming. But unfortunately, the thing to think about here is there have been so many pandemics that have been coming: the Spanish flu, the bubonic plague, many others like that. So no government ever thought of bringing the world together to solve these problems, right? So, for example, in Africa, we had a disease caused by a virus called the Ebola virus, which happened in Africa, right? So India did send help at that time, and we did whatever we could. But how can we achieve more? How can we achieve more is the more important thing that we have to think about. And we can have entrepreneurs, we can have thinkers who can think about how can you serve the entire globe or the global population in the field of healthcare. How can you provide basic materials, medicines, essentials, right? Like what happened a few months back, some company from India sent cough syrups to other countries, right? And 22 children died after
Yes.
having cough syrups, right? Is it not something that we should all sit and think about? Are we manufacturing such cough syrups? They are being exported to another country, and small children are dying because of having one cough syrup. This is the healthcare. This is what we have to think. What are we providing? What kind of medicines are we providing? Right? So we are only thinking about the top tier people. We have all the best hospitals. We have Apollo, we have Medanta, we have good hospitals. But what about these children? What about so many other people who are, suffering? And we think that America is a developed nation, UK is, Australia is all developed countries. But we have people who are living on the roads even there. Nobody thinks about them. What about those people who are living on the roads there? Why only India? We are discussing G20 countries. What healthcare facilities can we provide those people? Right? India is producing so many doctors every year. And what does everybody think? We think that, okay, we will go and we will settle in US, वहाँ पे बहुत पैसा है, we earn a lot of money. But we also have people who are staying on the roads there. Yes, they have better government policies than us. They are being able to provide more because they are developed nations. India is a very large country. It is a very populous country. We are not being able to provide those kind of healthcare regimes to our people. So we have to think about our this thing also, with how to support. But if you see the population at large, there is the water, sanitation and hygiene program going on, where for example, in the African nations, the sanitation and hygiene program, how to wash our hands, how to keep our bodies clean, how to maintain good sanitation, right? In 2020 also, imagine we are sitting and talking about how to wash our hands properly, not to defecate in the open. Even in 2022, we are discussing this, not only in India, but in Africa also. But the problem is that African nations have been under slavery and under such a lot of poverty, colonization, that they have also suffered a lot. But we have to think about where we are standing in today's date. In 2023, we are discussing problems related to sanitary this thing and water problems, food problems, famine is there, drought is there, no good food to eat. So this is really something that we need to think about as a global population. So now these quadripartite organizations, if I tell you, all these quadripartite organizations, they are trying to bring all these problems at a multi-level or a multi-dimensional or an international level, so that all the countries can jointly fight these problems instead of one single country fighting the problem and appealing to the other nations, oh, please come and help, because this is happening all the time, right? So we have to develop systems at the global, regional and national level. Regional means, for example, the Southeast Asia, that level, even China. A few months back only, China was facing such a huge COVID problem, right? There was again a huge lockdown, people were suffering. And when there is a problem in China, it automatically brings problems to the entire world. Why? Because China is the largest manufacturer of everything in this world. It is bringing problems to India, to the US, to every country. So this is something that we have to bring at the global level. But every country was against China because they felt that COVID has been brought in by them only. So nobody was trying to help that nation. But then the problem was that if we are not trying to help that nation, the businesses all over the world suffer. How do you manage all these problems? Right? So this is one thing that One Health program, these 4 organizations are trying to do, is bring the countries together on one platform.
Yes, ma'am. To add on to your your point of view, I was reading about this quadripartite MOU that they signed. Yes. So during that, I even got one major concern, that is even the more complex, but people actually don't understand the complexity about antimicrobial resistance. Yes. Because that is being a major issue, because people are not taking their doses, like the number of doses they have to. So yes. What is the concern brooding over in your view on that? Yes.
Yes. See, there are 2 things, as I just discussed with you. I was discussing about TB, right? Now, TB is a disease which requires a long-term treatment, 3 months. But people take it for 3 weeks, they start feeling better, they leave the medicine. And the problem aggravates, it increases. Why does it increase? Because of antimicrobial resistance. What is antimicrobial resistance? I don't know if you understand this term or not, if everybody understands this term or not, but
you can just tell in brief about it, because it's multi-departmental people are there, so they might not get.
Okay. So the thing is that, for example, you have a problem, you have a disease, okay? And doctor tells you that you have to take medicine for 3 months. You start taking the medicine every day, right? So when you start taking the medicine, the bacteria in the body, which are causing the disease, they start dying, okay? So you start feeling better. So you take the medicine for 3 weeks, you feel much better, and you stop taking the medicine. But what has happened inside the body? For example, there were 1,000 bacteria, right? So 800 got killed, but 200 did not get killed. Why? Because you stopped the medicine in between. The medicine which was to be taken for 3 months, you stopped it at 3 weeks. So 200 bacteria survived. Now those 200 bacteria know how to survive against that medicine that you are eating, right? And then those bacteria, they start growing and they become resistant to that medicine that you were taking. Means resistant means कि अब जब वो आप दवाई खाओगे तो वो बैक्टीरिया उससे मरेगा नहीं. It will not go, it will not die, क्योंकि उसके अंदर resistance आ गई है to fight against the medicine that you were taking, right? Now the patient stops taking the medicine. Again, after a few weeks, patient starts feeling ill. Why? Because the bacteria have grown again. अब पहले तो सारे बैक्टीरिया खत्म नहीं हुए, they have grown again. Now you again start taking that medicine, but बैक्टीरिया तो resistant हो गया, वो तो उसको fight कर रहा है, ठीक है, right? It is like a new strain coming. जैसे हम लोग कहते हैं ना, कोविड का new strain आ गया. What do you mean by a new COVID strain? It means कि जो पुरानी दवाई थी उसके अगेंस्ट उसने रेजिस्टेंस ले ली है, and a new bacteria has come up. Excuse me. So now the problem is the new bacteria has come, but science does not have a medicine for the new bacteria. The medicine is not there, but the bacteria has come. Excuse me. So there is no treatment. This is called antimicrobial resistance, where the bacteria develops resistance towards the medicines or the drugs that you are taking for the treatment. And ultimately, it becomes so difficult, so complicated that we are not able to save the patient. So this is called antimicrobial resistance. Another reason for antimicrobial resistance, I will tell you. For example, आपने दवा खाई, right? 2 medicines you did not eat. From there were 10 tablets, you ate 8, you did not eat 2. And you threw them in the drain. From the drain, it went into the water. So thousands of medicines are thrown into the water every day. Now the water that is being recycled, you are drinking that water again. So that water, that recycled water, that clean water also contains traces of that medicine, which we are drinking every day. So our body has bacteria all the time. So those bacteria can fight those small pieces of medicine that is going into your body, right? So it develops resistance. I will tell you a joke regarding this. Okay. बचपन में हम लोग मूवी देखते थे. There was a movie which came by the name of Wish Kanya, right? Wish Kanya, or the Poison Girl. How did they make the Poison Girl? They used to give her small doses of poison every day. Small doses of poison. So that girl did not get killed, but the poison kept accumulating in her body. The poison got accumulated, and one day she bit someone and that person died. Why? Because the poison had got accumulated so much in her body that she had become a poison girl, or the Wish Kanya, right? It is the same concept that we are facing today. Our bodies are getting filled up with these antibiotics that are actually, giving us resistance, and we might not be able to fight these diseases later in life when we grow old. Abhi to we are young, so we can fight it. Later on, we might not be able to fight it. So this is antimicrobial resistance. This is affecting the world very badly. So we need to tell and educate the patients ki please finish your medicines properly. And whatever discarded medicines are left, please don't throw them in the drain. Don't put them in the water. pack them off, and give it to the recycle person. There are so many companies who are recycling used medicines. Please give them to those persons who are recycling these medicines. Don't throw these medicines in the water, right? So this is antimicrobial resistance is a worldwide problem now, and it is growing daily because people are not aware. So this is a huge problem. I will come to this again in the next topic also, which is called the COP27. See, as of now, what has happened? I will tell you how this has started and how this is happening across the world. First of all, initially, we were only worried about human diseases. Okay, if I am having cold and you are standing by my side, then you will also have cold, right? So first it was human to human interaction, right? Or maybe humans to plant interaction. Maybe you eat something that does not suit your body. You have an allergic reaction. You have a problem. You have a health issue coming up. You know, it happens when we eat something, we develop an allergy to it, right?
Yeah.
Slowly and steadily, now we are having human to animal interactions where we are eating animals. We're eating, maybe sometimes we are eating uncooked flesh or improperly cooked flesh or contaminated flesh, which is causing human animal problems. So three things have come: human to human interactions, human to plant interactions, and human to animal interactions.
True.
For example, we say that COVID came because of why? Because of drinking bad soup.
Yes.
What is this? This is a human to animal interaction which went wrong. Or we talk about bird flu, or we talk about swine flu. Birds have a flu, but it can come to humans also if humans eat a bird which is infected by bird flu. Swine flu comes from pigs. So there are so many other things that can come from animals, right? Why? Because animals are also living in our community only. They are also facing a lot of problems. And if we eat them, we are having these problems. But why is the human, animal, and plant, everyone facing a problem? The reason is the environment. The environment is polluted. Not only in India, but across the world. Who are the polluters? We human beings. We have polluted. For example, our oceans are polluted. The Pacific Ocean, the largest ocean in this world, is polluted. Uske niche pe kya hai? At the base of the Pacific Ocean lie rubber tubes and tires of discarded vehicles. We have thrown our waste in the oceans. Marine life kharab ho gayi hai. Our fishes, our crabs, they've all got infected. We are eating those fishes and those crabs. We are getting sick. So the environment is to blame. Now everybody, the doctors, the professionals, the healthcare professionals, and everybody is realizing that environment has now become a big issue. The animals on the roads, the cows, the buffaloes, they're eating polythene. And then we are eating these animals, right? Another huge problem that is occurring across the world that I would like to discuss is regarding environment, is the global warming. Apart from pollution is global warming. The entire globe is warming up. The seas are melting. And which countries are at grave risk? The island nations. Island nations, like for example, Japan, Mauritius. All these countries, they're saying by 2050, Mauritius will be finished. That whole island country will sink underwater, right? So that is a huge problem. So we have to include climate or the environment in our health issues also. So many countries in US, so many beachside located cities are facing huge hurricanes, huge cyclones, tornadoes, huge loss of property, and some loss of life also. Why? Because of these cyclones, because of rising sea levels across the world. How do we target this problem? We have to target these problems. We have to include environment in all our issues. We have to get into recycling. We have to get into cleaning. We have to ban plastic, single-use plastic, at least single-use plastic from our daily lives. We have to indulge into garbage segregation. This is something that we have to make people aware, not only in India, but in US also, in Australia also, in UK also, in Africa also, China, everywhere this has to be done. Otherwise, the nations will go. Another huge problem that is taking because of global warming. The ice caps are melting. The snow is melting. Now the thing is, there are several bacteria, there are several viruses, particularly viruses, which are lying hidden, buried under those layers of snow. And they can survive freezing temperatures of minus 50 degrees Celsius also. They are so strong. But now they are getting exposed to the environment. Since the ice is melting, the viruses are coming out. The bacteria are coming out. That is why we are saying that we are going to have more pandemics in the next few years. Because we don't know what kind of viruses are those. Human beings don't know. Scientists don't know. We don't know how to fight those viruses. A virus which can survive at minus 50 degrees Celsius, we don't know how to fight it. COVID virus can survive at a temperature of 55 degrees Celsius. How will you kill the bacteria? We cannot survive at 55 degrees Celsius, but that virus can survive. Similarly, like it can survive at 50 degrees Celsius, we have viruses that can survive at minus 50 degrees Celsius. How will you fight them? This is something that all the nations have to come together and think. Right? But the problem is, when it comes to reducing carbon footprint, when it comes to reducing pollution, all the countries, they are not at par with each other. Every country is saying, you lessen your carbon print, you lessen your carbon print. They are not ready to look within themselves. We have to do it. They're looking at others. कि तुम अपना carbon print reduce करो. Right? So that is another problem that countries have to come together and fight. But this has to be, integrated. This has to be discussed. There are so many, climate-related meets that have happened all over the world. Some countries have taken aggressive steps, but there are some countries that are yet to take steps. And until and unless this is not done at an international level, we will not be able to achieve things, right? So, if we talk about the health regime, I was talking about the quadripartite organizations. One of those organizations is the United Nations Environmental Program. Why the environmental program? Because environment is important. If we don't clean the environment, we will not be able to survive. We human beings cannot survive the kind of pollution we are living in. It is not possible. So the integration of environment into the health has been reinforced. It was reinforced in COP27, and it has been taken up by the G20 countries as an important parameter today. Another thing is that we have discussed all these things, right? But what is the most important thing that we need to get this? It is funding. At the end of the story, we all need funds. From where will this fund come in? How much fund is needed? Chahiye kitna? The biggest problem is that the globe or the world, it does not have a centralized funding. It does not have a centralized funding. Now, G20 is based upon, economic stability, finances, businesses. We are talking about all these things. But we have not been able to bring in a centralized funding system, especially for healthcare. And if this does not come, then we will not be able to achieve anything in the long term, right? The World Bank has estimated that we need at least $10.5 to $11.5 billion to achieve these targets, to make the One Health program successful. Now, the problem is, if you see the current scenario, because of the Russia-Ukraine war going on, there is a lot of economic instability across the globe. A few days back, the American markets were going down, right? in such a scenario where, we are saying that we might face a recession in the coming few months, how do we bring these kinds of funds into healthcare? We're not being able to get those kinds of funds. Yes, we are able to get some funds due to, with the help of IMF, other international trading organizations, the private sector, some governments are helping also, but it is not enough. So what happens that when a new pandemic or a new problem comes, sometimes you're not left with funds. And we again have to start from a scratch. And again, when we are starting from scratch, फिर से शुरू करना है, फिर से शुरू करना है, again and again we are starting from scratch, then we are not able to achieve what we actually want to achieve. What we want to achieve, this gap in healthcare that has come up, we are not being able to achieve that. So funding is something very important. And especially if we are talking about the healthcare system, we would say that until and unless all the countries, all the international organizations, if we don't come together, if we are not able to fight this together, then we will not be able to achieve good goals. Right? So the positive thing is that we have the virtual space today. We can interact with multiple people across the globe, anywhere. Everybody has a smartphone. Even in the remote areas also, people have smartphones. So through that, we can connect to anyone across the globe. But all these parameters have to be taken into consideration for more healthcare integrated systems at the international level, the regional level, the national level, the villages and everywhere. So I think that's where I would like to end. That's where we need to think and incorporate more about how we can help, how we can bring in more healthcare professionals towards these systems.
Yes, ma'am. To add on to you, like from our childhood, we have studied like in our environment, what are the components like biotic? We have studied ecology. So in that it mentions that it's an interaction between biotic and abiotic components. And that is very important integrity that we have to understand. Even though it is taught in our basic levels, this should be taught in our like higher educations also, because people are not understanding there. If anything happens to that interaction, it will affect our health, also the environmental health as well. So that's why these things have been coming into the focus of these people, like the governmental organizations, big organizations. That's why these sort of quadripartite MOUs are also coming into scenario. So here, one thing I think that it's lacking, that is public awareness, because it's very important that people indulge in that, because although these organizations are being putting a lot many efforts, but it will only be successful when people will be coming and taking part in this.
So from this, Malti, this is a very good thing that you said, that public awareness.
Yes.
So we are 13 participants here today. So apart from me, there are 12 participants here. Is anybody a doctor among these 12 participants?
Sorry, ma'am. We all are students.
You're all students, and you are not medicos. So
not medicos.
You are not medicos. But you have learned a very important thing today.
Yes.
What have you learned? That this healthcare is very important. And one very important message that I'm giving to you all today. What message is that? That if you are not taking good care of your health, you will all have problems, right? You also all have to take care of your diet, right? I have told you about antimicrobial resistance. Yes. If anybody in your house is sick, your mama, your papa, your grandparents, your brother, sister, anybody, you all can tell them that you have to complete your medicine. Either don't take the medicine, or if you're taking the medicine, take it properly. Finish the whole course. Yeah. The whole course. Right? So 12 people here today are taking this message home.
True.
I expect these 12 people to go to their families and educate more.
True.
Right? So if you educate more, your parents or your friends or your siblings can educate more people. So this is how we can create a chain.
True.
So one person is educating about antimicrobial resistance to 12 other people, and those 12 other people who are now educated, who are now aware that prevention is better than cure. What simple steps can you take for your family? That is we are talking about the global health scenario. We're talking
Yes.
about the world, we're talking about US. Why not you and me? Why can't we start this? Right? You can go
Yes.
to your mummy, papa. Okay, mama, okay, papa. You're working the whole day. Okay, dada, dadi, nana, nani. एक बार अपना हेल्थ चेकअप करा लो,
Yes.
मेजर करा लो, हार्ट चेक करा लो, ईसीजी करा लो, शुगर चेक करा लो, small things, you know, body health checkup kara lo. There are so many things that come out by doing these small basic checkups. One blood test can tell you 100 diseases in your body.
True.
So at least if not the G20 program, maybe if you can all take this message home, it will be a success for me. I'll feel successful if I'm able to
Sure.
12 children here to take this message home. Prevention is better than cure. Tell your families, tell your mama, papa, or if somebody is smoking in the family, tell them not to do that. It's harmful. Maybe you are not able to make them stop from smoking or stop from drinking, but you know, at least एक बार बच्चा बोलता है ना जाके कि पापा मत करो ऐसे, या दादा मत करो ऐसे, या नाना नहीं करो ऐसे, तो कहीं ना it goes into your heart, it goes into your brain कि आज बच्चा हमसे बोल रहा है कि ऐसे मत करो. Yeah, mama, yeah, papa, you have to be there for us. You have to live a long life for us. They will feel good about it. So at least we can take this message home. If you take this message home, it will be a success for me.
Sure, ma'am. We'll surely for sure we'll take this message forward, and all other participants will also like. I feel that they got your message. Yes, ma'am. Along with that, one more
Yes,
thing.
ma'am.
Okay, somebody, please go ahead. Okay, ma'am. So I'll like along with this, one more point I would like to add, like all these initiatives are being taken, and lot many public awareness is also a part, but it's not in a momentum like in that sort of kind. But still, we will put forward our best, and I think research is one domain that where we have to like expertise in every domain. So so research can help a bit more in every sector, because what happens when research is coming into this, then this helps it to like in every sector, like even if it is in for food industry that is related to our health, everything comes and ends at our health only. If we are well, then the whole world will be well, like if and from individual to the world. So thank you, ma'am, for this interesting and interactive session, and I would like to present this word of thanks to you, certificate of gratitude. Okay, thank you, ma'am, for joining us.
Thank you so much. Thank you so much for a patient listening. I think we had a good interaction. I think Malti has been really interacting very well. And you know, when we talk, when we interact, you know, there are so many other points that come up that we might not have thought of. And you know, when we interact, we think about discussing those points also. ILG is something, you know, that is vast.
Ma'am, this is the certificate of gratitude we would like to forward. Thank you, ma'am. Ma'am, like to end this session, I would tell Vaishnavi to put forward the vote of thanks. Vaishnavi?
Good evening, ma'am. I'm B. Vaishnavi, giving the vote of thanks. I feel honored and privileged to get the opportunity to propose a vote of thanks on this special program. I would like to thank all the honorable delegates who blessed us with presence. I'm also very much thankful to Dr. Mandakini Shukla, ma'am, for your wonderful speech. You motivated the students by your speech, ma'am. The points you were included and mentioned about health, which is going in this present scenario of mental depression, health problems, etc.
The unprecedented rates are also changing in this COVID times. The organizations which were poor and health awareness, unorganized rates, environment, etc. I'm also very much thankful to the organizer Roots to Bloom and Atmanirbhar platform, SEIC GIT University. And at last, I would thank to all my audience for joining this event and making it successful. Thank you so much, ma'am.
Thank you. Thank you once again for patient listening. Thank you, Vaishnavi. And many thanks to Pradeep sir for giving this amazing opportunity to interact with you all. Thank you. Thank you so much.
Thank you, ma'am.
Okay.
Yes.